Thank you, Tom. So I'm going to talk to what do we know and how do we use it to reduce violent crime by 50%. And I want to start with a quote from Edna Chavez, a 17-year-old from Los Angeles, who spoke about her brother's murder to 500,000 people in Washington, D.C. for March for Our Lives in 2018. And she said, "I lost more than my brother that day. I lost my hero. I also lost my mother, my sister, myself to that trauma and that anxiety." She said, "Police departments and schools continue to profile and criminalize us. Instead, we should have a department specializing in restorative justice. We need to tackle the root causes of the issues. Policymakers, listen up. Fund mentorship programs, mental health resources, paid internship and job opportunities. We need to focus on changing the conditions that foster violence and trauma. That death is a tragedy. They say 1,000 is a statistic, but these annual statistics are not inevitable. They are preventable. They are horrendous numbers. 500,000 homicides in a year across the world, 25 million women raped, 1 billion child victims of violence, 7 trillion in loss of GDP. The world leaders have already committed to transformations to get results in the Sustainable Development Goals. SDG 5 talks about reducing significantly the number of victims of sexual violence. SDG 16 talks about reducing significantly the number of homicides and child victims of violence. We know a lot about the root causes and risk factors of those tragedies. These include lack of life skills, adverse childhood experiences in the family, youth exclusion, inequity, and guns. These causes and risk factors are not solved by more police and incarceration, as multiple studies have shown. I want to illustrate it by giving you a simple comparison between Chicago and Toronto, the third and fourth largest cities in North America. Identical populations, identical median household income. Chicago with 13,000 police officers, Toronto with 5,400. Chicago in a state that incarcerates at an unbelievable rate of 564 per 100,000, roughly 4 times the average world incarceration rate. Canada, slightly below the world average at 107. But Chicago has more than 500 murders in a typical year, and Toronto has less than 80. We need to think about these differences and what causes them. What are the risk factors? Are these guns? Are these social inequity? But they're certainly not police, courts, and incarceration. Today, we have solid violence prevention science on what actually reduces crime. We have multiple government academic sources that identify the same proven solutions, but we are not using them. These pictures of the covers are just some of the websites that are freely available. The last one, for instance, is that of the World Health Organization, covering over 3,000 different projects that have been shown to work. What I did in my book on Science and Secrets for Ending Violent Crime was to use those sources and many academic sources to identify what really does end violent crime and how it can be implemented and why there is a compelling case for us to make the transformations that our leaders have called for. In brief, what is identified by those sources can be listed. there are a limited number of winning solutions. This slide just shows 4 of those that achieve more than a 50% reduction over the typical system of police courts and incarceration in advanced countries. Outreach services to young males gets them out of gun violence. Parenting in early childhood reduces the chances of people growing up to be violent. Hospital-based interventions with victims give us information about how to tackle the risk factors and help people not come back to hospitals again. School curricula change the way that people think and act on their emotions. We also have 7 essentials for the implementation of science that have been identified by ECOSOC, the UN Committee on Social Affairs, and we're going to hear more about this when Jume Asiago talks from Habitat. They start with an Office for Violence Prevention. They go on to say the work should be guided by the science that is available. They talk about diagnosing the problem and mobilizing those who can tackle the causes. They talk about adequate and sustained funding, not project funding, not the sort of funding that we see in so many Western countries, including the US, that does not really do the job that needs to be done. And they talk about standards and training for the talent who must implement it, and they talk about involving the public. The cities that are successful are limited at this point, but some of them are in high violence countries. You'll hear later about Bogota, Coahuila in Mexico, and Diadema, which is in Brazil. Huge reductions, 50% reductions, and maintained over time. You'll hear about Boston, a short-lived success story because it didn't add the funding and didn't sustain and didn't have that Office for Violence Prevention. It's being replicated in Oakland, as we heard in San Francisco last November, and in other cities in California. In countries with lower violence rates, we now have the Glasgow model with an impressive 50% reduction within 3 years because they set up an Office for Violence Prevention, they followed the diagnosis, and that is now spreading to other regions in the United Kingdom, 18 regions already out of the 40, and London. In Ontario, these sorts of planning are required, but not necessarily the office. So what is adequate and sustained funding? It's roughly the equivalent of 10% of what we spend on police, courts, and incarceration. But we also have to spend the money on that Office for Violence Prevention. I like to call it the equivalent of a cost of a cup of coffee for every citizen in that jurisdiction. Surveys, surprisingly to politicians, because they don't seem to follow them, show that the majority of the public and victims from victim service surveys want prevention. We also know that many advocacy groups, from March for Our Lives to Black Lives Matter to many other, want prevention, and particularly those that involve mothers. We know that there are huge benefits. Yes, many lives saved, many fewer women raped, many fewer child victims of violence. But we also know that when you reduce violence, you can significantly increase GDP, particularly in lower and middle income countries, but also in the ghettos where so much of the violence, both on the street and in homes, occurs. And most of the proven actions are actually investing in the futures of people. I've listed here 3 things that I think are useful resources for faith leaders, and I will put them in the chat after I finish. So what is it that faith leaders can do? They can increase awareness about what works. So we need to help them have material for sermons, for religious services, for discussion groups and more about what works and how it's implemented. We need to get more human talent trained, and we can help the professional development of faith leaders by helping them have material in their initial training and in those who are actually involved in community outreach. We can also help with sustained investment in proven and successful programs by getting faith leaders to call for the shift from punishment to prevention. You're going to be hearing more about the international movement to accelerate decisive actions. So now I hand it back to Tom.